My name is Pepa and I'm going to talk to you about high blood pressure. Chronic high blood pressure, also known as hypertension, can lead to a variety of serious diseases such as heart attack, stroke, kidney failure, or eye problems. Some people develop hypertension due to a genetic predisposition or a medical condition. The risk of developing chronic high blood pressure increases with age as well. However, in most people, the main contributors to hypertension are lifestyle factors. Let's take a look at those. Smoking and alcohol. Smoking and drinking in excess, particularly binge drinking, are associated with an increased risk of developing hypertension. Smoking causes an immediate increase in the pressure of the blood vessels, and over time, it can lead to blocking of the arteries, resulting in heart attacks and stroke. Contrary to popular belief, the benefits of some alcohol drinking for heart health applies only to women over the age of 55, and they must limit their intake to 5 units of alcohol per week, which is about 2 standard glasses of wine. Even then, the benefit to heart health might be overshadowed by the potential damage to other organs. Let's look at being overweight. Carrying excess weight, particularly around the middle, has a strong link with developing hypertension. If you are carrying extra pounds, losing weight can be a positive step towards reducing your risk of developing chronic high blood pressure, or helping lower your blood pressure if you already have hypertension. Being active. Being physically active and exercising is another way to help reduce blood pressure. It has a direct impact on it, but it can also help us lose weight, feel more relaxed, and sleep better. And all these effects will also benefit your cardiovascular health. Let's look at eating. What you eat also contributes to your risk for developing hypertension. In particular, how much sodium or salt you eat. The recommended amount of salt per day for adults is 6 grams, which is about a level teaspoon. In the UK, it is estimated that adults consume about 8 grams of salt per day, which is well above the recommended amount. Surprisingly, most of the salt we eat doesn't come from seasoning the meals we cook at home or adding table salt to the food on your plate. About 3/4 of the salt we eat has been added to our food before we buy it. Foods that are generally high in salt include crisps, salty nuts, olives, cheese, crackers, anchovies, breakfast cereals, tinned soups, bread, pasties, and pizza, processed meats such as sausages, bacon, or ham, smoked meats and fish, brined and pickled vegetables, stock powders or granules, sauces such as gravy, ketchup, mustard, brown sauce or soy sauce, ready meals and takeaways, and biscuits, cookies, and cakes. Many food manufacturers display a voluntary traffic light label on the front of the pack that includes information about the salt content. Foods that contain less than 0.3 grams of salt per 100 grams are low in salt and are colored green. Above this amount, but below 1.5 grams of salt, they are colored amber. And if they contain more than 1.5 grams, they are colored red. If you're trying to reduce the amount of salt in your diet, pay attention to this information when you shop. And try to choose foods that are green over amber or red. And if you eat foods that are amber or red, try to eat a smaller portion. In addition to checking food labels, other tips that can help you reduce the amount of salt in your diet include reducing the amount of processed foods you eat, replacing salt with other options to flavor your food, like pepper, herbs, spices, garlic, or lemon juice. And eating more vegetables. Diets that include plenty of vegetables have been associated with better outcomes for blood pressure and lower risk of heart disease.